By popular demand, okay, 2 people asked, today I'll go over 10 books that I recommend in the general ballpark of psychiatry, psychotherapy, and mental health. I'll divide these roughly into books intended for the general public and books for professional audience, although any such division is not exact. You feel free to read any of the books I mention. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator. If you like what I'm doing here, please like this video and subscribe to More Than Meds. This is far from an exhaustive list, and I may do another of these videos in the future. Let me know what you think in the comments. Let's divide this into books aimed for the public and books aimed for mental health professionals. To get us started, let's begin for books for general readers, and we'll start with a classic, Man's Search for Meaning. Written in 1946, Dr. Frankl, a psychiatrist, recounts his experiences in Nazi concentration camps in World War II. This book has been translated into more than 50 languages and has sold more than 16 million copies. His concentration camp experiences led him to the conviction that finding meaning in life is our strongest drive. The discovery and pursuit of meaning can get us through all adversity, even death camps. Frankl developed logotherapy, a form of existential psychotherapy that helps clients explore meaning and purpose in their life. The book is inspirational and hopeful, the kind of book you can read and reread. If you haven't seen it yet, you should get on it. As a bonus, I've read another book of his, aimed for a more professional audience, called Psychotherapy and Existentialism, Selected Papers on Logotherapy. I can recommend that one too. Several of my other books in the general readership category are all about 10 years old now. The first of these is The Body Keeps the Score. This book by Bessel van der Kolk, 2015, is a perennial bestseller. It discusses the way emotional trauma, especially fairly severe emotional trauma, affects us physiologically and at brain centers beneath our thinking rational mind. It argues for somatic therapy, meditation, yoga, neurofeedback, and so forth to help heal trauma beneath the level where we can rationalize or intellectualize or even really vocalize at a more physiological level. Dr. van der Kolk is a principal figure in what's come to be called trauma-focused or trauma-informed therapy. Although in my opinion this perspective is sometimes over-applied, it remains an important framework for helping patients. In recent years, both the book and its author have faced a good deal of criticism. Many have pointed out that some of the treatment options mentioned in The Body Keeps the Score have weak empirical evidence, and that Dr. van der Kolk himself is personally offensive in various ways, that he's sexist or anti-Semitic, although he refutes that, he says he's not, and that he's just too full of himself. I have no personal opinion about the man. I've never met him. I've never heard him speak in person. But criticisms of his psychological work, his scholarly work, are definitely fair game. They should lead us to question whether and how much to put our faith in popular psychological interventions and trends these days. All the same, in my opinion, that's no reason to avoid his book, which is chock full of information and good ideas. It's fascinating reading and it covers a lot of ground. Just read it with a little bit of skepticism, really as you should read anything, and you'll enjoy it. The next book, also from about 10 years ago, is Saving Normal. Dr. Alan Francis was former chair of the Department of Psychiatry at Duke University, and also was the principal author of DSM-4, the Diagnostic and Statistical Manual of Mental Disorders, the 4th edition, published by the American Psychiatric Association and in use from 1994 to 2013. But this book, Saving Normal, actually argues against the overuse of psychiatric diagnosis, He argues that the realm of normality gets narrower and narrower the more psychiatric diagnoses we have and use. That's why the book is called Saving Normal. In particular, he criticizes DSM-5, the current edition, which was published first in 2013, still in use. The book also discusses fads in psychiatric diagnosis, which is a special interest of mine. The way certain diagnoses suddenly gain popularity and you see them and hear about them all the time, and they're on everybody's mind, and then all of a sudden they go away. The trend moves on. For example, when I was in training, when dinosaurs roamed the earth in the 1980s, there was a fad to diagnose people with multiple personality disorder. There were clinics cropping up, people talked about it all the time, and then the fad ended, and those clinics closed, and there are still people who have multiple personality. We still do diagnose that occasionally, although now we call it something else. It's called dissociative identity disorder, or DID. But it's not the fad that it once was. That came and went. It's likewise interesting to think about what diagnoses are currently popular but won't stand the test of time. They'll turn out to be fads. In any case, Dr. Francis discusses these trends in psychiatric diagnoses and diagnostic inflation from a unique insider perspective. It's interesting reading, and I'm sure you'd like it. Another book that's critical of psychiatry, but in a more scholarly way, is Mind Fixers. Professor Anne Harrington is a historian of science at Harvard University. She writes about our biological enthusiasms and how they've led to tremendous research efforts, blockbuster medications, and have really set the language of biological psychiatry for decades now. And yet, all this has far less to show for it, practically speaking, than you might imagine. Harrington focuses on the history and the sociology of biological psychiatry. For example, that it became popular not due to new scientific findings, but to help the field of psychiatry gain legitimacy and a sense of purpose. She talks about the influence of pharmaceutical company money on psychiatric diagnosis and the economic factors that influence the biological viewpoints in my field. But unlike less sophisticated critics, Harrington recognizes when biological psychiatry has had its successes, too. She doesn't throw out the baby with the bathwater. This is someone who's clearly not anti-psychiatry. She clearly cares about the plight of the mentally ill and my field's efforts to try to relieve that suffering. If you're looking for a book with a careful criticism of psychiatry, one that doesn't reduce it to simplistic ideas of good guys and bad guys, this is a good book. And the last book I wanted to mention under the general readership category is one that I've recommended to a number of my own patients. Adult Children of Emotionally Immature Parents. This one, also from about 10 years ago, is an easy to read and very validating discussion of how one's parents' emotional conflicts and vulnerabilities affect their children. Some have criticized the phrase emotionally immature in the title. They claim that it trivializes serious personality problems in parents, but the book itself really doesn't. Conversely, it would be easy for a book like this to demonize parents, maybe play into the current trend to go no contact with family. She doesn't take the easy way out there either. The book doesn't trivialize bad parenting, and it doesn't jump to the conclusion that you can't deal with parents who have personality issues. It's not about blaming. After all, your parents got their personalities from their parents, and so on. The first half of the book lays out the problem, how parents with problematic personality styles create difficulties for their children. They can screw up their kids, not intentionally, not because they want to, but because they can't do anything else. They're not able to, because they can't help it. And the second half of the book is on what to do about it, how to deal with difficult parents once you're an adult yourself. Going no contact isn't always the best solution. Since dysfunctional family dynamics are a common root cause of what brings people to my office, I've had the occasion many times to suggest this book to my patients, a number of whom have come back and told me that it seems to reflect very accurately what it was like for them growing up. Let's turn now to books aimed for mental health professionals, and there are many to choose from. I'll just name 5 in this video. The first and oldest is Borderline Conditions and Pathological Narcissism by Otto Kernberg, 1975. The psychiatrist Otto Kernberg, who, by the way, is still alive and well, I believe, at the age of 97, back in 1975, wrote a book that really was one of the founding texts of what we call the American Object Relations School of Psychoanalysis. In this book, he contrasts normal and pathological narcissism, making the case that narcissism falls on a continuum from normal to disordered or pathological. He says we're all born narcissistic. Babies feel they're the center of the universe. They need only cry and magically they get fed. And that hints of narcissism persist in all of us through adulthood. For example, the pride we take in our own achievements. But pathological narcissism, in Kernberg's view, is infantile narcissism that persists into adulthood, carried forward in life due to disordered views of self and other, what are termed distorted object representations. Kernberg's views are often contrasted with those of another author, Heinz Kohut, founder of the self-psychology view of psychoanalysis. Kernberg emphasized primitive defenses and distorted object relationships, whereas Kohut talked about empathic failures, unmet empathic needs. Their divergent views shaped a major debate in late 20th century psychoanalysis. I'm kind of agnostic in terms of how I feel about those two viewpoints, but Kernberg's writing is easier to read than Kohut's, and so that's why I'm including it here. I've mentioned this book to trainees and even occasionally well-educated patients, mainly to emphasize that narcissism falls on a continuum from normal to pathological. The other 4 of these books are by 2 of my favorite authors who write books about psychotherapy for trainees in the mental health fields. The psychiatrist Glenn Gabbard and the psychologist Nancy McWilliams. We'll start with the textbook I use every year to teach psychiatry residents their introduction to psychodynamic psychotherapy. Long-term psychodynamic psychotherapy, a basic text, by Glenn Gabbard, now in its 3rd edition, copyright 2017. This easy-to-read text is a nice balance, a little bit of theory and a great deal of practical advice and suggestions regarding how to conduct psychotherapy. It has chapters on the initial evaluation, on defense mechanisms, on transference, different types of interventions, and so forth. It's written really at the perfect level for someone who's brand new to learning about how to conduct psychotherapy. A different sort of introductory text is Psychoanalytic Psychotherapy, A Practitioner's Guide by Nancy McWilliams, and copyright 2004. In contrast to Gabbard, this book is more scholarly, it's more historical, goes into more depth, more detail. It's less nuts and bolts. It may be best for trainees who've had a year or more of experience already doing some psychotherapy under supervision, or for clinicians, psychotherapists out of training, who seek an in-depth discussion of the basic concepts of psychodynamic psychotherapy and psychoanalysis. I choose Gabbard's text to introduce psychotherapy to psychiatry residents because I only have 10 or 12 seminar sessions to present a very big field in a fairly short amount of time. But the text by Nancy McWilliams is a lot more interesting for me to read personally. Both of these authors wrote other books expanding on psychodynamic and psychoanalytic ideas. Psychodynamic Psychiatry in Clinical Practice by Glenn Gabbard, in its 5th edition, copyright 2014, extends psychodynamics to group therapy, couples and marital therapy, and even the psychiatric medication clinic. He offers chapters on the psychodynamic approach to various DSM-5 diagnostic categories. Psychotherapy for anxiety disorders, for substance abuse disorders, for various personality disorders, and so forth. His more expansive discussion in this book in some ways rivals what Nancy McWilliams wrote in the book I just mentioned. But Gabbard has a more medical psychiatric viewpoint since he's a psychiatrist. And finally, Psychoanalytic Diagnosis, Understanding Personality Structure in the Clinical Process by Nancy McWilliams, 2nd edition was copyright in 2020, is a highly regarded popular textbook that breaks down personality into paradigmatic subtypes and then goes on to discuss psychodynamic or psychoanalytic psychotherapy for each of these personality types. As I discuss in another video you can look at right here, I wouldn't have titled this book Psychoanalytic Diagnosis. McWilliams isn't really diagnosing anyone. What she's offering are personality paradigms, a kind of typology, and in doing so, she's really illustrating that single subject case formulation and strict psychiatric diagnosis lie on a kind of continuum. We actually need both to be effective clinicians. I hope this whirlwind tour of 10 books has been helpful. As mentioned, I may do another video on more books. There are a lot more to choose from. Please let me know in the comments what you think of the books I just mentioned, whether you recommend them or don't recommend them, and any other books that you might want to share with the other viewers of this video. If you can stick around, the YouTube algorithm thinks you will really like this video as well. Please like and subscribe to my channel. Thanks, and I'll see you next time.